According to the American Cancer Society, more than 60,000 people in the U.S. will be diagnosed with pancreatic cancer this year alone. Sadly, about 48,000 will die from it. As with any cancer, though, early detection is a key to survival. And what else can be done to help survive pancreatic cancer? Dr. John Christein is a surgeon with Alabama Oncology. He joins us now to talk about this. Dr. Christein, good morning.
Good morning. How are you today?
Doing very well. Talk about what happens when someone has pancreatic cancer.
Well, so unfortunately, pancreatic cancer over the past 20 to 30 years has doubled in incidence in the country. And it's also estimated that by the year 2030, pancreatic cancer is going to be the second leading cause of cancer death behind lung cancer. So we're seeing it more and more. Luckily, we have a great team at the Grandview Cancer Center. So when these patients do come in, they're able to see us. Obviously, when people come in, it's a shocking diagnosis. And so that's why we applied this team to see them.
Before we move on to talk about how you treat it, do we know why we're seeing more of it right now?
We don't really. It's probably just environmental. You know, the Western diet and the Western lifestyle.
So you have something called the Pancreatic Center of Excellence, is that right?
Yes, ma'am.
And what is that about? Is that treating just pancreatic cancer, obviously, or talk about what you guys do?
Well, so at the Grandview Cancer Center, we, treat all kinds of malignant disease. We recently applied for the Pancreatic Center of Excellence with the National Pancreatic Foundation, and we're approved for that. And what that does is highlights our multidisciplinary team approach to taking care of these patients. For instance, when a patient comes in, we just had a patient yesterday who came in, a young lady from Tuscaloosa in her 50s. And we were able to have her seen by a medical oncologist to talk about chemotherapy, and myself from the surgical aspects. And she also went over and had her endoscopy to make the diagnosis and put in some stents for palliation. So, that's the real benefit of the center, is to be able to take care of these patients in one visit.
And that is so important. I've had family members and loved ones who've battled cancer over the years, and it really is that waiting and that not knowing. So I would imagine that really can alleviate a lot of the worry, even though you're dealing with something you never imagined.
Oh, yes. The psychological aspect is extremely important, not only for the patient, but for the family as well.
And so if someone is concerned about this, is it hereditary, or is it something totally that you mentioned environmental, is something totally made up of your diet?
Well, it's the environmental aspect is really unclear. And as far as the hereditary nature, there are some families and some genetic mutations with pancreatic cancer, and we can see it in families. It is very rare, though. It is very rare. And if there's any suggestion of it, we immediately start doing genetic profilings, and then we employ a genetic counselor to go over that and then get the rest of the family members screened. But, it is very rare. So much different than with breast cancer or colon cancer.
So early detection, obviously, like any cancer, is important. So when someone is diagnosed with pancreatic cancer, have they had symptoms that could have gone overlooked or they didn't pay attention to, or is it obvious?
Yes, ma'am. And that's the problem with pancreatic cancer, and that it presents so late in its course, is that the symptoms often don't show up until they are somewhat advanced. So now, with patients getting CT scans much more often, we are finding the incidental pancreatic cancer or pancreatic mass when someone undergoes imaging for a different reason. So there is some early detection, but there is no standard as far as mammograms or colonoscopies, PSAs, that kind of thing. So it is difficult, but we are making some progress in that area with imaging and with endoscopy.
So elaborate on that a little bit. So someone's having some tests done for they don't know what's going on or something else perhaps, and then the pancreatic cancer is discovered. Is that what you're saying?
Yes, that can happen. And, the pancreas makes digestive enzymes, and it also makes insulin and other hormones that control blood sugar. So sometimes one of the first symptoms could be a patient who's otherwise healthy in their 50s or 60s or 70s, and all of a sudden their blood sugar is going up. And so often that gets chalked up to type 2 diabetes, but let's say you don't have risk factors for type 2 diabetes. Well, it could be a problem with the pancreas. So, new onset diabetes without another source is something to watch out for. Also, the bile duct goes through the pancreas. So a common presentation for pancreatic cancer is when someone is jaundiced. That's kind of standard that everybody thinks of.
Okay.
When the cancer actually blocks the bile duct, and unfortunately by then that's the first symptom you had. So you already have a fairly sizable cancer at that point.
All right, well, let's wrap up with how it is treated. And there is hope for people who are diagnosed with this type of cancer.
Yes, ma'am, there is definitely hope. So our goal is to get patients in within a week when they are referred to the Grandview Cancer Center. On that first visit, they will see a surgeon, a medical oncologist, a radiation oncologist if needed, and even an endoscopist if needed. Now, for pancreatic cancer, we try to do chemotherapy first all the time, and that gives us better results when we get to an operation as far as being able to remove the tumors. The chemotherapy takes about 3 months beforehand, and oftentimes we can start that chemotherapy the same week as their first visit with all of our team. And that's really our goal, is to get treatment started within a week, which is often very obtainable.
Well, Dr. John Christein, surgeon with Alabama Oncology over there at Grandview, just a very thorough explanation, and we really appreciate the time that you spent with us this morning.
Well, thanks for having me, and I'm happy to talk to anybody out there if they have any questions.
Very good. Thank you, sir. Have a good day.
Yep, you too. Have a good day.
All right, 8:29. We'll be right back.